Family planning benefits the mother, children, father, and family. It impacts everyone in the family, just as the size of the family has an impact on the quality of life.
According to a survey in 2022, over 5.6 Filipino families live in abject poverty. This is supported by the most recent survey released by the government itself.
Given the average Filipino family size of 6 people, this translates to at least 33 million Filipinos living in perpetual poverty. They claim this accounts for nearly 30% of the total population of 111 million Filipinos. That is, 3 out of every 10 Filipinos are poor and hungry.
Women in poor households are less likely to practice family planning than those in non-poor households. This difference is due mainly to the higher prevalence of female sterilization among non-poor women than among poor women.
There is no room for the family's economic progress. As the household's number of people increases, per capita income is spent on individual needs, leaving no room for savings.
Family planning allows people to attain their desired number of children, if any, and to determine the spacing of their pregnancies.
It is achieved through the use of contraceptive methods and the treatment of infertility.
Abstinence. The most efficient birth control method is abstinence. Abstinence means choosing not to have sexual intercourse.
Withdrawal. To avoid pregnancy, the withdrawal method of contraception is to remove the penis from the vagina and away from the external genitals before ejaculation.
SDM, also known as standard-based method. Standard-based method identifies the fertile and infertile stages of the menstrual cycle by utilizing the body's natural physiological changes and symptoms during the menstrual cycle.
Artificial contraception is available in both temporary and permanent forms. Interim forms of contraception. Use of a barrier. A condom is used to prevent sperm from reaching the ovum in this method.
Hormonal method. The primary hormones involved in the menstrual cycle are estrogen and progesterone. Hormonal methods include raising or lowering the amount of hormone which aids in pregnancy.
Hormonal way of contraception can be done in either one of the following ways: contraceptive pills, vaginal rings, patches, direct injection of hormones, and intradermal implants. Intrauterine device or IUD. Intrauterine devices are T-shaped copper or plastic rings placed in the uterus to prevent pregnancy.
Lobectomy. It's a long-term contraception procedure for women, commonly known as tubal sterilization. It is a surgical technique that blocks the fallopian tubes, thus preventing the eggs from reaching the uterus.
Vasectomy. It is a type of male birth control that restricts the supply of sperm to the semen. The sperm tubes are cut and sealed to do this.
Contraceptive information and services are fundamental to the health and human rights of all individuals.
The prevention of unintended pregnancy helps to lower maternal ill health and the number of pregnancy-related deaths.
Delaying pregnancies in young girls at increased risk of health problems from early childbearing, and preventing pregnancies among older women who also face increased risk are important health benefits of family planning.